To introduce our speaker, this is Dr. Kyl Myers. She is back to speak with us again today. She is the Director of Community Education and Partnerships for the Family Planning Division at the University of Utah's Department of Obstetrics and Gynecology. Today she will provide an introduction to family planning resources and programs that are available in Utah, as well as speak about creating a network for family planning care in our state. Thank you for joining us.
Hi, everybody. It's good to be back. Thanks for participating today. So this afternoon, I'm going to mention several resources that are available so that you can provide the most comprehensive contraceptive care to your clients and reduce the economic and geographic barriers that they might be facing right now when they're seeking family planning services. I have a fun FYI before I start. So around 12:18 today, there's going to be, most of us are going to be receiving a text message. It's a test of a national emergency alert system. So I just wanted to give everyone a heads up because I don't know if things are going to get weird for a minute and if everybody's phone is going to be going off. So we are silencing our phones here, but I have no idea if it's going to override it. So please mute your computer until the Q&A portion. And if you get that, don't worry, it's just a test. Okay, so in case anyone is new here and hasn't been participating the whole time or when I spoke last time, my name's Kyl Myers. I'm an assistant professor in the Department of Obstetrics and Gynecology at the University of Utah. My training is in sociology, but I direct the statewide contraceptive initiative called Family Planning Elevated, and I'm going to tell you more about that today, and towards the end I have a special treat for you all. I have nothing to disclose. Some learning objectives that I have for this presentation are that I want you to understand that there have been some recent legislative changes that are expanding contraceptive access for many Utahns. And so starting January 1st is really when we're going to see these be implemented. And we are anticipating that this is going to change your practice, and this is going to change the clinic volume, and this is going to change it's going to increase the number of patients that we think are going to be seeking contraceptive care. So we just really think it's important that you understand that changes are coming. The second learning objective is that I want you to understand that there are federal, pharmaceutical, and online resources that are available to you to be able to help you reduce economic and geographic barriers to contraceptive care for your clients. And then the third is that I want you to know that there are training opportunities available for you. We're going to have a list of resources that are available to you for, more online resources, but that we at the Family Planning Division at the University of Utah are a training resource for you. Some important takeaways are that there are numerous family planning resources available to your clients, and one thing that I think is important that I hope sticks with you is that I just don't want you to be a barrier to care for your patients. It's really important that you're all practicing at the top of your license and that you're not having to refer your clients to other providers for services that you actually have the license to be able to do. So the first thing that I want to start with is that we know that the health insurance is probably one of the biggest predictors to being able to access contraception. So the Affordable Care Act, or the ACA, has something called the Contraceptive Mandate, and that was issued in August of 2012. And this requires that most private health insurance plans need to cover all of the U.S. Food and Drug Administration approved contraceptive methods without cost sharing. So all Medicaid and PCN and Utah clients can also get whatever contraceptive method they want without cost sharing. So almost all of your privately insured clients should be able to get any method that they want, including IUDs and implants, and they shouldn't be paying a copay. There are some exceptions, though, in Utah. Some insurance companies that we are aware of don't abide by the contraceptive mandate, and they require a pre-authorization for some methods. And so there are some people who have insurance but aren't able to get an IUD or an implant without having to pay for it. So we would consider these clients underinsured and in need of other resources. But since the ACA and the contraceptive mandate was enacted, there's been an increase in contraceptive use, especially of IUDs and implants, and it's largely due to the removal of cost barriers. So this image illustrates the health insurance coverage gap, and so I'll kind of be using this more as the contraceptive coverage gap, but they're one and the same. So on the left, the red is representing people who are covered by Medicaid, and currently in Utah, Medicaid eligibility is very limited. On the right, the blue represents people who have health insurance or maybe through their employer or the marketplace subsidies. But we have in the middle here, we have about 16.8% of Utahns who are uninsured. And this percentage is higher among young, low-income women. So those who are considered most at risk of unintended pregnancy and most in need of contraceptive services. So right here really is this coverage gap that there's been some legislative changes that's going to help reduce that gap, be able to fill it, and more coming down the pipeline. And so with those people, kind of exiting this coverage gap and going into either Medicaid or maybe eventually they're, have an employer that's covering their health insurance, they're going to be seeking services that they're now eligible for and weren't able to pay for out of pocket. So one of the biggest changes that has happened, and it's really exciting, is during the 2018 legislative session, the Medicaid Family Planning Waiver passed. And what this did was increase eligibility for Medicaid-funded family planning services for Utahns with incomes up to 100% federal poverty level. And what that means is that for a childless person, it means that they make an income of about or less than $1,000 a month. For a family of 4, this is an income of about $2,000 a month. That means they're meeting that threshold of 100% federal poverty level. So anyone who's at that or making less money than that is going to be able to qualify for this Medicaid family planning waiver. And it's just family planning services, so it's not full expansion. This is scheduled to go into effect on January 1st, 2019. Enrollment would begin 30 days before that. So in December, we would see people starting to enroll in this, but in January 1st is when they would be able to actually come and utilize those services. So really the primary reason that we're doing Project REPP and Family Planning Elevated, which you'll learn more about, is to help providers and staff and advocates like you to prepare for these upcoming changes and the increase of eligible patients who are going to be seeking services in your clinics. So if you serve uninsured patients or self-pay patients, many of these folks are going to become eligible and they're going to enroll, or we should be helping them enroll and know that they're eligible. And many of them are going to want contraceptive methods. So our question is, are you and your staff and your clinic prepared to meet the contraceptive needs of hundreds or thousands of clients? And Family Planning Elevated and our team is really here to help you. And I'm going to go into more details about exactly how we intend to help you towards the end of the presentation. Included in the Medicaid Family Planning Waiver are some comments about immediate postpartum LARC. So immediate postpartum LARC, or IPP LARC, you might hear the acronym. It's being able to place an IUD or an implant soon after childbirth. So an IUD can be inserted immediately after the placenta is delivered, and an implant can be placed prior to being discharged from the hospital. So this is a safe procedure and it's safe for breastfeeding. And the Medicaid Family Planning Waiver includes coverage for IPP LARC with Medicaid, and it debundles the reimbursement for providers. So sometimes there was this global reimbursement fee, and now it separates that. So you can get reimbursed for doing IPP LARC. It's really important to discuss postpartum reproductive goals with your pregnant clients. If they report that they don't want to become pregnant soon after they give birth and they want to use contraception, you can offer immediate postpartum IUD or implant placement, and they can be planning for it and knowing that they're going to be getting that in the hospital. And you can also offer, the standard 6-week contraceptive visit, or just let them know whenever they are ready to talk about it. You're there to support them with resources. So if you're a provider who attends births and you want to be trained on immediate postpartum IUD insertion, you can contact me. The Family Planning Division offers free IPP LARC trainings, and we can come to you, your clinic. My email address is going to be at the end of these slides, but just in case you're going to pop out, it's kyl.myers@hsc.utah.edu. Another bill that was passed in the 2018 session authorizes pharmacists to dispense user-dependent hormonal methods of contraception. So this includes oral contraceptive pills, the vaginal contraceptive ring, and the contraceptive patch. This is going to be done under a standing prescription from probably the state health department. So I want you to know that, yes, Utah is a state where individuals can get contraceptive methods from the pharmacy. That is legislatively passed. The logistical kinks, however, are getting worked out, and we're expecting that we're going to be seeing this go into effect in the spring, of really maybe seeing corporate pharmacies taking this on, or we'll keep you up to date with this, okay, as soon as we find out more about it. But yes, Utah is a state that now has the ability to be able to do this, which is fantastic. And as healthcare providers and educators and advocates, I'm hoping that you are aware of the initiatives that are on the Utah ballot this year. The one that I'm going to tell you about today is Proposition 3. So if the majority of Proposition 3, you're going to be seeing it as Utah Decides Healthcare. If the majority of Utahns vote yes on Prop 3, then Medicaid eligibility is going to expand up to 138% federal poverty level for full Medicaid. An estimated 150,000 Utahns are going to become eligible for Medicaid, including comprehensive contraceptive services. So it's those 50,000 people that I had just mentioned who are becoming eligible under the Medicaid family planning waiver will essentially be absorbed into Medicaid expansion. However, what you need to know is those 50,000 people are still going to be eligible starting January 1st for care. The way the timeline works for Proposition 3 is the vote is happening in November. I know ballots are being sent out now, and it's polling like it's going to pass. So I just want you to be aware of that. It will go into effect, if it passes, in April of 2019. So there's going to be about 4 months where it's just the Medicaid family planning waiver, and then this is going to be being implemented with the full Medicaid expansion. But we just want to stress the importance of making contraceptive care an integral part of your business, because if you don't, clients may seek the services somewhere else. You can check out, I put it at the bottom of this slide, utahdecides.org, if you want to learn more about Proposition 3. So another resource or program that I want you to know about is Title 10. So Title 10 is a federal program that assists low-income individuals in accessing family planning services. This includes a sliding scale fee structure for contraceptive methods based on income. As of now, Planned Parenthood Association of Utah is the recipient of the Title 10 grant in Utah. And Planned Parenthood has 7 health centers in Utah where clients can access family planning services using Title 10 funds. So this is a map. The dark blue dots are these Title 10 clinics. So there's Logan, there's one in Ogden, Salt Lake, West Valley, South Jordan, Utah Valley, and St. George. Planned Parenthood also has subcontracts with rural health providers to improve contraceptive access for clients outside of these urban areas where Planned Parenthood health centers are located. So these providers are located in Mount Pleasant, Ephraim, Price, Manti, Moab, Cambridge, Escalante, Circleville, and Cannonville. So if you have a client who wants contraceptive services, but either there aren't trained providers in your health center or your client can't afford your rates, then you can refer clients to Planned Parenthood so that they can take advantage of the Title 10 funds. We, of course, want all health centers to see the value in being able to provide contraceptive services to their clients, but we want to make you aware of Planned Parenthood as a resource for you. I'm not going to go too in-depth with 340B pricing, but 340B pricing is a government program that allows hospitals and clinics serving low-income populations to obtain discounted prices on certain drugs. And I'm assuming that you already know if you work in an organization that has 340B pricing or not. So clinics that are eligible for 340B pricing can get all types of contraceptive methods at a discounted price, but maybe one of the most significant price breaks for 340B eligible clinics is that they can purchase a hormonal ID that's called Liletta, and they can purchase it for $50. This is likely to increase to $100 soon. However, if this is something that you're just learning about, you can absolutely get in before this change. If you have 340B and you can order Liletta, and they have a shelf life. They are not milk. They will be fine for a while if you wanted to take advantage of the price point that it's at right now. But something that I have found in talking with FQHC providers and other folks is that they don't know about Liletta yet. And Liletta really did just come on the market a few years ago, but it's something that you can take advantage of. And so some clinics are able to buy it for $50 and then just charge their patients $50 for it. And you get to decide how that works in your business structure. However, looking at Liletta, it's produced by a nonprofit pharmaceutical company called Medicines 360, and so you can look into that more, but I would strongly encourage you to know that this is it's a levonorgestrel IUD. It's a competitor of Mirena, and at $50, it is much more affordable for your patients who have maybe been having cost prohibitions to be able to getting that. If you want to learn more about 340B drug pricing, you can visit the website that is on this slide. Another resource that's available to you is a faxes, a group purchasing organization. So any entity that has a greater than 20% patient volume of Medicaid, patients can join a faxes. And this means that they have access to reduced pricing on many products of relevance for family planning providers, so all types of different contraceptive methods. And their website is here. A program that you should know about is the ARCH program. It is operated by Bayer Pharmaceuticals, and Bayer is the maker of the IUDs, the Mirena IUD, the Kylina IUD, and the Skyla IUD. What this program does is it does provide low-income, uninsured patients with a device at no cost. So clinics can help clients apply for the patient assistance program, and the device will typically arrive within 6 weeks if the patient is eligible. It doesn't, however, cover insertion or removal fees, so you would need to let your clients know about that or figure something out if you're wanting to be able to make this work for your clients of even reducing insertion or removal fees. It's a really great option to be able to get a free IUD. However, the downside is the wait. We should really be striving to get clients methods when they want them, and a 6-week wait can really be the difference between a client not being able to come back to the clinic or returning with an unintended pregnancy. But I do want you to know that it's available for you. And you can just go to archpatientassistance.com to learn more about that. I know that someone had asked about clinical trials, and we wanted to bring it up again. So the University of Utah always has clinical contraceptive trials going. We are a member of the Clinical Trials Network, and we are consistently enrolling participants in these trials. So participants are able to get methods at no cost, whatever method is being studied at the time, and they're often compensated for their time as well in participating in these studies. So currently, as of October 2018, the division has a copper IUD trial going on right now and a contraceptive ring trial going on. There's a screening, an eligibility screening happening now for a trans-cervical sterilization trial. Amy Orr is our clinical research study coordinator, and she's very accessible. You as providers or clinic staff or community health workers can reach out to Amy and ask her what studies are going on right now and what type of patient criteria, eligibility criteria there are, so that you can just know these options are available for your patients, or you are absolutely welcome to give your patients Amy's email address and just refer them directly to her to see what's going on. So that's amy.orr@hsc.utah.edu. I know you've heard Bedsider be mentioned several times during the REPP series. It's a very wonderful tool for you and for your clients. There are reminders that your clients can use for needing to take the pill every day. They can set a reminder. They can set reminders for needing to go get pill refills or shot reminders. And you as providers can also order materials. They have tear-off sheets. So this image right here that has, it's an efficacy chart. There's tear-off sheets, and they're in English and they're in Spanish. And you can buy a packet of them for $5, but I know there are also other resources that are available where they could just send them to you at no cost, and we'll link to that at fputah.org. But Bedsider has a patient-facing website, and also in the top left corner you can click on providers, and there's more of a provider-facing site. It is a really incredible resource. It really breaks different methods down, and there's videos of actual users talking about them, kind of pros and cons of them, side effects. It's very user-friendly. There on bedsider.org, there's also a clinic locator, so if you have a clinic that provides contraceptive care, you can get your clinic in that directory. We can help you with that, but we just want you to really know about bedsider.org because it's a really great resource. I'm not going to go too in-depth with these either, but I think that you need to know about them because they're becoming very popular. They're being talked about a lot, and you should be aware of different online apps and websites and different contraceptive delivery services that are available that people might be taking advantage of, or they might be asking you some questions about these things. So there are apps that can be used on a smartphone to help track people's periods and their fertility. 3 options of these apps that I'd let you know about are Natural Cycles and Kindara and Dot. But I recommend that you take some time to really understand fertility awareness-based methods so that you can talk about these methods and apps that are becoming more popular with your clients, and really not discounting them, that many people are interested in using fertility awareness-based methods and that you should be familiar with the different types of methods. We have an expert here on staff, a professor named Rebecca Simmons, and you can ask her more information, but we want to be a resource to you if this is something that you would like to be learning more about. There's also services now for delivery of contraceptive methods, really like literally to a client's doorstep. So I found 2 that seem to deliver to Utah. They're not based in Utah, so there's different organizations or these corporations all over the country, and they can ship to different places depending on state laws. Utah clients will have what I found is the Pill Club, and I have no idea how to pronounce this other one. Have you ever seen these or heard this one? I have no idea. PRJ, I have no idea. So, Project Ruby. It's probably Project. There you go. Project Ruby. I even looked. They didn't have anything on their website about how to do it. Of course it is. It's Project Ruby. The K threw me off. So what happens is the client will have a video conference with a provider, and there will be a questionnaire where they can figure out if this client is going to be, if it would be a good fit for them to use specific methods. So after they do that, then the company can mail these methods to the client's doorstep. They can bill their insurance. These options are great for people who want to use user-dependent methods like the pill or the ring, and it's great for people who have health insurance that cover contraceptive methods. However, this can be really cost-prohibitive for low-income, uninsured folks. I know Project Ruby, I think, is $20 a pack of pills, and I know sometimes people can think that's not that expensive, but that can be very cost-prohibitive for somebody. So it's really good to know about the ever-growing options that are available online so that you are informed and so you can discuss these with your patients. Dr. Garn mentioned last week this app from the CDC, the US MEC and US SPR, but I wanted to reiterate how great of an app this is if you're a provider. It's free. You can just search CDC Contraception on the App Store on your phone or iPad, and it can really help you in real-time counseling. You can pull it, you can bring it up when people are telling you if they have any type of chronic conditions while you're doing contraceptive counseling, so that you can consider their chronic conditions and be able to feel confident in the types of methods that they are wanting, that you would be feeling confident that it would be a safe option for them. So we are, oh good, we got the presidential alert. Fantastic. So we're going to put a list of additional resources on fputah.org for you. Some of these are going to include tools for forecasting the costs of, like really looking at your clinic flow and your patient population and figuring out how many IUDs or implants or what types of methods you should have in stock and how many, so you're really making cost-effective decisions with building your inventory. There's also going to be resources for developing your capacity of your staff to provide contraceptive counseling. Contraceptive counseling doesn't have to be done by MDs or DOs or PAs or CNMs or NPs. It can really be done by medical assistants. Registered nurses can be fantastic at doing the counseling, and so really figuring out how to utilize all of your staff, all of your patient care team to be optimizing time and clinic flow here and making sure that everybody is kind of taking ownership. The patient education resources, will have some of those available for you too. This will all be on fputah.org, and as you'll see when you visit it, we're continuously adding resources to it. So if you have something in mind, or if you have a question, or you want to be linked up to some resources, please feel free to reach out to us and ask us, and we'll do what we can to get some resources on the site and also send them to you. And we also have a team of experts here at the University of Utah in the Family Planning Division. They absolutely want to hear from you. This is their job. What you can do is you can call the University of Utah hospital operator. So this is the main hospital line, 801-581-2121. You can save that in your phone. And if you're ever having any type of issues or questions and you need more a speedier response, you can call and ask for the on-call family planning person, the on-call family planning provider. There's always somebody who is on call. So any questions that you have, they are more than happy to assist with, whether they are basic or complex contraception questions, if you're dealing with the complex removal, if you need to have some referrals for options counseling or options for any pregnant patients that you may have, anything that's family planning related that you're just feeling is a little bit outside of your wheelhouse, you can call the family planning on-call person. And truly, always on call. So I don't know how many of you are doing IUD removals or anything at 2 a.m., but if you needed to call somebody, we're available for you. Okay, so over the last year, we have been working really hard on designing and implementing Family Planning Elevated. So FPE is a statewide contraceptive initiative, and our goal is to improve the intended pregnancy rate through expanding contraceptive access. So we're working in parallel to all the Medicaid and other state-level policy changes that are happening to help health centers build capacity to meet the needs of the clients. So this is including provider and staff training, as well as our Family Planning Elevated Contraceptive Access program. And I'll go into a little more detail on both of those things. So we have a conference scheduled for Friday, January 18th, 2019. It is going to be at the University of Utah Guest House, and our keynote speaker is Dr. Maria Rodriguez from Oregon Health Sciences University. She's an OBGYN, but a big part of her research focus is Medicaid and how Medicaid family planning waivers and Medicaid expansion has really, and even the pharmacist dispensing has rolled out in Oregon. So she's going to be providing the keynote and really kind of helping motivate the patient care team to understand what is coming for Utah. There's going to be plenary sessions on Medicaid changes and patient-centered counseling, and there's going to be breakout sessions with different tracks for different health center staff roles, including provider tracks and clinical support staff and administrative staff. And we are thinking of everybody who is in the health center staff and the different levels that providers might be at. So for providers who haven't received IUD or implant training, we will have a 2-hour IUD training. You will be leaving, having didactics and having hands-on practice with all of the different types of IUDs, the copper IUD and the hormonal IUDs. And then you'll also get an Nexplanon training, so you feel comfortable and that you will leave certified to provide implant care and services. We are going to be doing patient-centered counseling and really helping medical assistants understand how they can be assisting with the comprehensive contraceptive care. They will learn how to set up the instrument trays for LARC insertions and removals. We're going to be working with billing staff, with front desk staff, with administrators, with CEOs and CFOs, everybody who's on the patient care team, to make sure everybody's on the same page and figuring out the role that they can play in making sure that your clinic is prepared for all of these changes. So breakfast and lunch are going to be provided, and there's going to be a reception and a raffle drawing to close it out, and there are hotel rooms available. It is on a Friday all day from 8 to 5. You can find out more information on fputah.org, and we're going to send out information we have all of your email addresses, so we'll be sending you information about the conference and when the registration link is up soon. But I did say that I have a treat for you. Because we are so grateful that you have participated in Project REPP, we are going to cover your registration fee. So for any REPP participant who wants to attend the Contraceptive Education and Training Conference, we're going to comp your fee. We'll send an email to our list of participants with instructions for registering, so you don't really need to do anything. We will come to you. But we're hopeful that, you know, this 6-week series has inspired you or kind of helped motivate you to think that it's going to be really critical for you to provide comprehensive contraceptive care and be prepared for this increase in patients that are going to be entering health centers soon. We want to train you and your team, and we want to keep a partnership going between your organization and ours. So we really do look forward to seeing you all on Friday, January 18th. I'll do my best to make sure there's snow if you want to turn it into a skication. So one of the other components of Family Planning Elevated that we're very proud of is the Family Planning Elevated Contraceptive Access Program. We have received so far $5 million in funds from philanthropic foundations for the Contraceptive Access Program. We've also received pharmaceutical support in donations of IUDs and implants. So I'm going to give you the broad overview of it, but what we're going to be doing over the next year is selecting 11 health organizations to partner with. We're going to provide them with cash grants ranging from $38,000 to $100,000 to help defray the costs, the expenses of having to purchase the equipment that's necessary for contraceptive provision, and maybe personnel expenses if a health center is needing to hire somebody to be able to provide the care. We are going to be providing customized on-site training for all providers and staff at these member clinics, and this is to help health centers meet the needs of existing and newly eligible Medicaid clients and privately insured clients. But I think the really incredible cherry on top of all of this is that we're also going to help stock clinics with IUDs and implants and reimburse members for providing contraceptive services for uninsured clients with incomes up to 250% federal poverty level. So the people who are still going to fall in the contraceptive coverage gap even after the Medicaid family planning waiver, and even if the ballot initiative passes and there's full Medicaid expansion in April, there's still going to be a coverage gap, and there's still going to be thousands of people who need access to affordable or no-cost contraceptive care. So our goal is to provide 13,000 uninsured clients with contraceptive care over the course of 3 years. And we're going to do this at these 11 health centers that we partner with. So to be eligible for FPE CAP, eligible members must be a health center in Utah that serves Medicaid and uninsured clients. We want to improve contraceptive services, to these clinics that may not currently be doing comprehensive contraceptive care. And so we need people who are going to be willing to partner with us for 2 to 3 years. The actual partnership will be for 2 years where you're getting the support and the reimbursement, and then there's some data follow-up for the 3rd year to see how you're doing. We are going to be selecting our first 3 members. The application is going live in the middle of October, really in about a week and a half to 2 to 3 weeks. We're going to be sending it in an email to all of you as well in case you're interested, and so you don't have to keep looking at FPU Utah. We will send it out to you as soon as the application is live. And we're going to be selecting in November and announcing in December for a launch of our first FPE program in January of 2019 to run parallel with the Medicaid changes. We're going to select another 4 clinics in the summer of 2019 and another 4 clinics in late 2019. So we're creating a health center directory so that we can guide Utahns to health centers in their communities where they can access comprehensive contraceptive care. We do get a lot of Utahns, individuals who reach out to us wanting to know, where they can go. And so we need to know where you are. We need to know what you need. So you're going to hear from us as we build this directory. But we want to add you and help link clients to your health center. This directory is also going to be able to serve as a referral network and a training and proctoring network. We really want to be able to strengthen any type of gaps that we are seeing, maybe in rural areas. We are learning, we're seeing that there are some communities or regions where somebody may want an IUD, an uninsured patient, but there's no one in her community that can insert one, and so she has to travel 2 to 3 hours to be able to get an IUD, maybe from a Planned Parenthood clinic, which is fantastic that those resources are available, but that those are enormous geographic barriers that we're trying to reduce, and so we need to know about you so that we can help people find you. So this directory, though, because it will also serve as a training and proctoring network. I know that we're at the University of Utah, and we're absolutely willing to travel, but we understand that sometimes it can be difficult to come to Salt Lake City for a training. And so being able to link up with a provider who may be in a neighboring county who could train and provide is what we're trying to help with as well. So we want everyone to be practicing at the top of their license and providing evidence-based, best practice family planning services. So my email is right here. It's kyl.myers@hsc.utah.edu. The Family Planning Elevated phone number is 801-213-2252, and we have a website that we're continuously adding to. If you ever have any questions, please feel free to email us or call us or reach out to us or share the information, because this is what we're here for. What questions do you have? I know I unloaded a lot of information on you and a lot of resources on you, and I'm hoping you knew about some of them, but I'm also hoping that you learned something new. Can I answer any questions that you might have? And you can unmute your microphone and ask directly, or you can type your question into the chat box. Any questions?
How do we add our clinic to the directory you mentioned?
So we're going to be reaching out to all of you, and so we'll figure out like an easier form that we can start with. We'll just ask you a few questions, and we'll be building this directory so that once all these tens of thousands of people are becoming eligible for Medicaid services, and we think it's going to be kind of changing the conversation in Utah, we want to have this directory available at the beginning of the year so people can just look at fputah.org and maybe put in their zip code, and it would link to your clinic. So we will be reaching out to you. You are more than welcome to reach out to us too. Maybe you want to be on the steering committee. We'll probably expect an email from us maybe within the next 4 to 6 weeks is when we'll be starting to reach out to build it.